And at this stage, I'd like to welcome Professor Geoffrey Braithwaite, the founding director of the Australian Institute of Health Innovation at Macquarie University, to say a few words. Those of you who don't know Geoffrey, and I'm sure there's very few, he is a leading health services and systems researcher with an international reputation for his work investigating and contributing to systems improvement. He has expertise across culture and structure of acute settings, leadership, management and change, and I could go on for hours and hours around Geoffrey, but I guess the key thing is he's president of the International Society for Quality in Healthcare, representing more than 70 high, middle and low income countries. And he also recently received the Sydney Sachs Medal for Health Services Leadership by the Australian Healthcare and Hospitals Association. Please welcome Geoffrey Braithwaite.
Thank you, George. Thank you very much, and thanks for the warm description, which I'll now proceed to not live up to. But seriously, thank you for also agreeing to MC our work. Secretary Pearce, welcome, and colleagues from around the country, and those who will see this later, maybe internationally. So a little bit about us. Let me frame what's going to happen today in terms of research about medication safety. Let me frame that in the context of the work we do here at Macquarie in the Australian Institute of Health Innovation. So in most medical and health research, people have a lab. We actually don't have a lab, even though we do health and medical research, because our laboratory is the health systems of Australia and the world, because we investigate what's happening and try and improve things. Our logo is Heal, Learn, Discover. We spend most of our time in discovery because we're a research group, but we also do learning and teaching. The ultimate aim is healing, not just of individuals, but health systems that need our research to help improve them. So we really like those three words. That's us. You don't really need a picture of us because you're here, but we're an integrated health science group with a hospital and clinics and researchers like us and other researchers in more traditional medical and health mode. We've got 7 research centres, and what you see on the tin is what we do. So we do research ranging from implementation science and looking at the system and how resilient it might be, through to work we're going to hear a lot of today, safety and quality and safe systems of care, through to Enrico Coira, who's a doctor who became a health informatician in the early days of computers and medicine, and who's interested in health informatics and artificial intelligence and big data, through to health economics and health financing with Henry Cutler. And then we've got some other centres funded by National Health and Medical Research Council, which are additions to our university centres. So it's kind of like a flavour of us just by looking at the centres and what their titles are. Why I say that is not necessarily to advertise the Institute, although I'm always happy to do that as the director of it, but to say if your work or your interests map to any of those other ideas beyond what we experience today, well, just get hold of us. We're happy to work with partners, and in fact we do. So at a glance, we run about $47 million worth of research and another $58 million which we partner with people that we don't administer the research, we partner with other people across the country and internationally. We've got about 125 research projects going on at any point in time, and 24 projects that we work with other people that they administer in usually other universities or other health systems outside of New South Wales. And there's a couple of hundred of us and a whole bunch of research students, and we publish a lot of work. In fact, if you have any problems with running out of reading material, we have a fix for that. So, one of the things we were interested in was how well New South Wales did in the last couple of years during the pandemic. And really, it was exemplary. We were very proud to do a whole lot of research to help underpin COVID-19 and the pandemic, and you can look at those papers or we can send them to you. But we were really pleased to see and impressed at how New South Wales had really done major work, leading the world in many respects, to keep patients safe. And we monitored that, and we monitored the progress of that. We also monitor ourselves because we're a research group. And one of the things we were personally worried about was, would we sustain ourselves as a research institute during a pandemic? Of course, we're worried about the population and its safety, which New South Wales was looking after. But would we do that? So we tracked our performance across time, thinking about the pandemic and whether it would affect us and impair our capacity to do research that's needed during the pandemic, but also research that's going to be needed as we come out of the pandemic. So this is grants under management, and we've remained buoyant, even though it's very difficult territory. This is publications. We mapped our publications and said, are we going to take a hit and not be able to publish as much? Well, we maintained our progress under the pandemic there too. What about staff? Are we going to lose all our staff? Will they go and join New South Wales Health, for example? Well, some of them did, to help with managing the pandemic on the front lines or in policy circles. Well, we retained our momentum in being a research group, and also higher degree research students. We continued to graduate them and get new ones. So we were very pleased with our own performance, because it's very existential when you go through a pandemic, not just for the population and the difficulties from a health point of view, but will you yourself thrive and survive? So we were pleased that we continue to build on that momentum. A couple of things in concluding, because I'm here just to really frame what's going to happen next. And invite the Secretary to address us. A couple of things by way of conclusion. A couple of examples. We do a lot of work in New South Wales. In fact, most of our work, most of the things you saw there where we publish a lot of papers, have a lot of staff devoted to research. Most of our work is done in New South Wales. Because we're domiciled here, this is our home territory. But we also have quite a large international footprint, a national and international footprint with our work. So let me give you just a couple of examples. One is that we have led a series on international health reform. I just want to focus on the third book in that series. Now, you can go and buy this book. It looks really cool next time you do a Zoom behind you on your bookshelf. It's 500 pages, but I thought maybe I should summarise what it says in 2 slides, just to save you that trouble. So this is a book where we got people from right across the world, all the coloured countries are in this book. They contributed a chapter. So we didn't get a few countries in South America, and a couple of countries that we could not get to by the time we went to press. And what this book says is there are 5 major trends running through and shaping health systems into the future. The need to be sustainable, the need to exploit new data coming from genomics, precision medicine, emerging technologies, global changes in demographic dynamics, including ageing populations everywhere who will need more care, and new models of care. And the pandemic taught us that, didn't it? That we can deliver care in different ways. These are happening now in any case. But what this book also told us is the system as we know it is changing to a better system if we get it right. If we get it right. So we're moving towards 2030 to have more integrated care, more value for money, to be more patient-based, to have universal coverage so everyone gets care that they need, to exploit IT better than we do now, to have healthy, health-literate populations, to focus not as much as we do on acute but also preventive care, to have high quality, safe, standard-based care, and to develop the workforce of the future because it needs to be different from the workforce of now because there are so many changes afoot. So we think that's a pretty good predictive model for 2030 if we get it right. And we know, because we've mapped this to what New South Wales is doing, that New South Wales is at the forefront of doing that, and some of the other states too. So our future research strategy is to do more work like this with OECD, World Health Organization, International Society for Quality, and other national and international bodies. So in conclusion, just a couple of observations on World Patient Safety Day. It's World Patient Safety Day with WHO at the moment. And WHO has made much of the fact that we need to do medication without harm. This is its theme for this year. Well, wasn't Professor Westbrook prescient in starting work 15 years ago, and especially 6 years ago, to look at this issue? She foreshadowed what WHO would be thinking. Her work exemplifies work that we've done for 10 years or more on Safety 1 and Safety 2. We've published lots of books on this topic about how to keep patients safe. And the idea of Safety 1 and Safety 2 is, mostly we've looked at when things go wrong, but we should also look at least as much on how things go right so often. It's okay to look at harm, that's Safety 1. But surely we should also look at when the system performs well and learn from that. And in the past, we haven't been as good as that, at doing that. Now we are. We're much better at that. So Safety 1 is where the number of adverse outcomes is as low as possible, trying to make sure things don't go wrong. That's very important. But what we added in the last 10 years with colleagues across the world is, how can we improve the number of acceptable outcomes so that they are as high as possible, trying to make sure things go right more often. We think this is a very powerful model. So we're going to hear examples across today of both Safety 1 and Safety 2 approaches, but we're especially interested in taking a positive approach to make sure things will go right more often. So the answer to the question is, we need Safety 1 and Safety 2, and that will be what you will sample when you experience the research that we will present as it unfolds for the rest of the day. So you made a great choice in coming here. Sit back and relax, start to formulate questions, enjoy yourself, and if you want to contact me, that's how you get me. But really, let's hear from the Secretary. Thank you very much for accepting our invitation. We're deeply grateful. Thank you indeed.
I'll introduce you.